What is phenotypic DST in TB drug susceptibility testing? Imagine trying to see if bacteria can survive in the presence of medicine by watching them grow. That's exactly what phenotypic drug susceptibility testing in tuberculosis does. It's a laboratory method used to find out if the bacteria causing tuberculosis are resistant or sensitive to specific drugs. This test is considered the most reliable way to determine drug resistance because it looks at how the bacteria actually behave when exposed to drugs, not just their genetic makeup. In this testing process, scientists take a sample of the bacteria from a patient and grow it in a controlled environment. They then place the bacteria on special media that contain certain amounts of anti-tuberculosis drugs. These amounts are called critical concentrations. They are set at levels that should stop 99% of bacteria that are susceptible to the drug from growing. If the bacteria grow despite the presence of the drug at this concentration, it means they are resistant to that drug. There are two main ways to do this testing. One uses solid media, like Lowenstein-Jensen, which is a type of egg-based medium. The other uses liquid culture systems, such as the MGIT 960 system, which can give results faster. Liquid systems tend to be quicker because they allow bacteria to grow more rapidly and make it easier to detect growth. One big advantage of phenotypic testing is that it can detect resistance regardless of whether the bacteria have known genetic mutations. Sometimes bacteria develop resistance through mutations that are not yet identified by genetic tests. Phenotypic testing also shows how resistant the bacteria are, which helps doctors decide the best treatment plan. But this testing isn't quick. Because Mycobacterium tuberculosis grows slowly, traditional phenotypic tests can take several weeks to produce results. This can be a challenge when quick decisions are needed. However, new technologies are being developed, like microfluidic devices combined with imaging and artificial intelligence, which could reduce the time to less than 12 hours in the future. These are still being tested and are not yet standard practice. Phenotypic drug susceptibility testing is especially important when dealing with drug-resistant forms of tuberculosis, like multi-drug-resistant or extensively drug-resistant TB. It helps doctors choose the right combination of drugs to effectively treat the infection. The World Health Organization updates the protocols regularly to include new drugs and resistance patterns, ensuring the testing remains relevant. In summary, phenotypic drug susceptibility testing is a culture-based method that directly observes how Mycobacterium tuberculosis responds to anti-TB drugs. It provides essential information on whether the bacteria are resistant or sensitive, guiding effective treatment choices, and helping control the spread of resistant tuberculosis. Always remember, if you or someone you know is being tested or treated for tuberculosis, it's important to consult healthcare professionals for personalized advice and care.